Hey friends, welcome back to the channel. My name is Dr. Caroline, a practicing board-certified family medicine physician, and today I want to share with you some time management tips that can help you be a little bit more productive. As a primary care physician, having really good time management skills is essential because it will help you be more efficient, and efficiency is key to improving productivity. So the first time management tip I want to share with you is reviewing your schedule. One of the biggest reasons why this is important is because if there are any scheduling errors, this is the time to get them fixed before you actually start seeing your patients. So you can do this the day prior or the day of prior to you seeing your patients. So for example, if a patient is scheduled for a virtual visit, but they really need to be an in-office visit, this is the time that you want to make that switch, and vice versa. So if they're scheduled as an office visit, but you feel that the visit can be accomplished as a virtual visit, then you can make that switch as well. Taking care of these scheduling issues or problems prior to you seeing your patients will help you avoid the hassle of having to deal with those problems at the time of the patient's appointment, because that will eat up your time when you're already in the flow of your workday. And it's not just about scheduling errors, right? Let's say you're doing some procedures, you want to make sure that any equipment, any supplies are actually in stock before those patients come in. So all of that will help you manage your time better and keep your workflow going smoothly. And so this avoids any interruptions in your workflow and it helps you be more productive. The second time management tip is delegation. I've said it before, delegation is a superpower. Accept it and use it. Allowing support staff to take care of tasks that do not require you as the physician to complete is such a great way to manage your time and dedicate that extra time towards your patient or other things that do require your attention as the physician. Now, personally, there are still some things that I do that I can certainly delegate to my staff. So this is still a work in progress for me as well, but I am way better than I used to be before when I used to want to do everything myself. So delegation has been such a massive game changer for me in terms of helping me manage my time better, but also maximizing productivity. The third and a very important time management tip is prioritizing must-be-done tasks. So these are tasks that must be done before you walk out of the clinic on a particular day. As primary care physicians, it's not just about seeing patients and completing charts, but there's always 1,000,001 tasks that we also have to manage within our workday. And this is always so draining. I mean, this is probably the part that I dread the most about my workday. So because there's so many tasks that have to be done, the key thing when we're talking about managing time better and maximizing productivity, you have to prioritize the tasks that must be done today, that particular day when you're in clinic. You have to prioritize the tasks that must be done that day, and you have to stick to that. So let's say we're talking about the in-basket, the dreaded in-basket. So one thing I do before I even start addressing anything in my in-basket is tagging those requests, those messages, results that I know I will need to address that day. So typically when there's new messages, new requests, etc., they're typically in bold, they're bolded. So when I tag or click on a message or request or a result, it removes the bolding. So that way, when I do start addressing my in-basket, I already know which results or requests or messages I need to address that day. So that way, I'm not scrambling around throughout my workday trying to figure out what needs to be done or get overwhelmed because there's so much that needs to be done. The goal is to prioritize and be intentional about what needs to be done on a particular day so that you don't feel drained or overwhelmed trying to get everything done in one day. Back when I was still really new as an attending, like in my first year or two, I used to think that I needed to get every single task completed before I walked out of the clinic. And I used to walk out 7 or 8 p.m. at night, nearly every workday. Well, this led me straight into burnout. It wasn't great. I didn't know how to manage my time. Well, I thought I did, but clearly I didn't because I ended up burning out. But now I have a workflow that helps me get my administrative tasks completed in a more efficient and productive manner. I have some general guidelines that I use to prioritize the must-be-done tasks for each workday. Now I'm going to create a separate video on that particular topic, specifically how I manage my in-basket in order to maximize productivity. Definitely do look out for that. Time management is so important because it allows you to be intentional about what needs to be done and what must be done, which helps with efficiency and maximizing productivity without you feeling overwhelmed or risking falling into burnout. And also, the more time you can save from not doing unprioritized tasks, and when I say unprioritized, obviously I'm not saying that the tasks that you do not complete that day are unimportant or less important than the other ones. They're just not the priority for that day. They are next day's priority. So the more time you can save from not doing unprioritized tasks, the more time you can dedicate to your patients and be more of service to them. So time management will be a game changer all around. Alright friends, this was a quick video just sharing some tips that can help you manage your time better and maximize productivity. If this video was interesting to you and you'd like to see more content like this, then definitely consider subscribing because I do post a video like this every single week. Again, do look out for next week's video because I'll be talking about how I manage my in-basket to maximize productivity. I know a lot of people ask these questions, especially residents who are gearing up to get into their attending roles. I know this might be an important topic for you. If you're interested in joining our RVU consulting program, the link is below if you're interested. Also, do check out the free training video I've linked below as well. Thank you so much for watching. Make sure to leave a like and share this video with your colleagues. I'll see you next time.